Good morning, students, again. And in the second video on the radius, I am going to tell you about the bony features of the radius. Okay. And for the description of bony feature, I have just first tell you about the features onto the upper end, and then I will tell you the features of the bony features of the shaft, and then I will tell you for the lower end. So let's come to the bony features of the upper end. If you will see the upper end of the radius, okay, just see that this is the right radius which I am describing, okay, that should be in your mind. Now there is a articular disc like structure here. So this is the disc which forms the upper end of the radius, and if you will see the top of this, there is a concavity which articulate with that of the capitulum of the humerus. Then this on the medial aspect, this articular surface, which is the rim of the disc, it articulates with the radial notch of the ulna, okay, to form the superior radio-ulnar joint. And the rest of the rim of this ulna, radius, okay, outer circumference, it articulates with another ligament, what is called as the annular ligament. Now just distal to the disc-shaped head, this is the neck, okay, it is a narrow, almost cylindrical neck is there. And then below the neck, on the medial aspect, you can notice a tuberosity, that is called as the radial tuberosity. Is nothing but the rough and partly smooth on one side. It is the radial tuberosity, okay, and this is just a elevation from the surface, okay, rough and smooth both, okay. Now then I come to the shaft, and for the description of the shaft I will say that this has 3 borders and 3 surfaces, okay. I will just trace the borders and surfaces with that of the white chalk so that you can follow. Now 3 borders are the anterior border, which begins with the anterior aspect of the radial tuberosity. See this radial tuberosity? So it begins with the anterior aspect of the radial tuberosity, and if you will trace with the finger this anterior border, it will go towards the lower end where it will end on the stellate process. Okay, see this bony projection in the last video we have seen that is called as the stellate process. So this is called as the anterior border, okay. And for the posterior border, I will have to turn the bone toward the posterior aspect. So from posterior aspect of the same radial tuberosity here, if you will trace this here, the border, as I am tracing with the this chalk, white chalk, this will go to the posterior aspect of the lower end. So this is the posterior border. The third border which you should learn is, and feel it with the finger, and this is the sharp border, to which we have said as the medial border or intraosseous, and it begins just below the radial tuberosity, okay, on medial aspect. And then this sharp border, as I am tracing here, it is going and it will continue here onto the posterior margin of the radial notch. You see this? This is the radial notch is here. Just I will lift it and so you can see it clearly. This is the radial notch where the head of the ulna will come and fit here to form the inferior radio-ulnar joint. So to the posterior margin of this notch, this border will continue, okay, this border. So this is the medial or intraosseous border. In its upper 2/3 part, okay, in the lower 2/3 part, this border will give attachment to the intraosseous membrane, which forms the middle radio-ulnar joint. So you have seen the upper radio-ulnar joint, the inferior radio-ulnar joint here, and this intraosseous membrane will form the middle or central radio-ulnar joint. Now after borders, then to see the surfaces is quite easy. Between this intraosseous sharp medial border and this anterior border, this is the anterior surface of the body or the shaft. And if you will trace this anterior surface of the shaft towards the to the lower end, anterior aspect of the lower end, it is slightly concave and smooth. Okay, slightly. So remember that the lower end is slightly concave and smooth. Now if I turn this radius and see the posterior aspect of the radius, then this is the posterior border and this is the interosseous border and this is the posterior surface. Okay, this is the posterior surface of the bone, and down below it will continue with the dorsal surface of the lower end. Then there is another surface, and this surface is between the anterior border here and the posterior border, and this is called as the lateral surface. And this lateral surface, as I said, that it is slightly convex laterally. So the concave convexity, the gradual convexity, you can see onto the lateral side. Okay. Now these were the borders and surfaces. There is a roughening almost in the middle of the bone, shaft of this radius. And then this is for the attachment of the muscle. Just remember that. Okay. Now we come to the description of the lower end. Now there are many, it is an expanded end as we have learned already, and it has many surfaces. See here, onto the anterior end, the lower end, this is the anterior surface which is quite smooth, okay? And then just opposite to this will be the dorsal surface. So there is an anterior surface and then there is a dorsal surface where the posterior tubercle is present. Many grooves are seen here. See this, many ridges are seen here, and this is for the lodgement, or through these grooves passes the tendons of the extensor muscles of the forearm. So forearm extensor muscles which are going, taking origin from the forearm and going to insert onto the hand. Okay, these are the extensor muscles, and that's why grooves are caused here. Okay. Then you see here the medial surface of the lower end, and in the medial surface of the lower end, as I shown you, that it is a notch-like structure which articulates with the head of the ulna, and this forms the inferior radio-ulnar joint. So this is the radial notch. Okay. Now, if you see another surface, that is the lateral surface, and this is quite narrow, and to this lateral surface, if we will trace down, it will end in a pointed bony projection, what is called as the styloid process. Then there is an inferior surface which is articular, and then two articular surfaces can be seen. Okay, on its lateral surface, it articulates here, okay, with the scaphoid, and then or more medially it will articulates with the lunate bone. Okay, it will articulates with the lunate bone, and this articulation will form the wrist joint or the radiocarpal joint. This will be called as radiocarpal joint. Now to the margin of this radial notch here, okay, through which the head of the ulna will articulate. Okay, now there will be an attachment of the triangular articular disc. Okay, that I will tell you when I will teach you the particular features of this bone in detail. I think this completes the bony features, okay, of the radius. So upper end, lower end and shaft, 3 borders and 3 surfaces on the shaft. Thank you very much.